Hi, I'm Tony the vet, and I'm here with Huna London just to talk you through some of the reasons and some of the benefits of vaccinating your cat and your dog. There's many benefits. The main benefit, I think, is you're doing your bit for the dog or the cat community around you. There's a lot of illness out there waiting to happen, and if people aren't vaccinating their pets, a lot of these diseases will get out of hand, and it's taken many years to get them under control. So vaccination is really going to keep the future generations of cats and dogs and pets nice and safe and happy. So it's really worthwhile doing it, and it's something I would advocate that we should all do if we have a cat or a dog. So usually what would happen is if you got a new pet, like a new puppy or a new kitten, you would have a vaccination at about 8 weeks old. Usually that would involve a vet check and just a look over to make sure everything's okay. Not all cats and dogs come from the most ideal homes, so sometimes they start off rather poorly, and you end up having to try to make a bit of a difference to make them healthier and a lot more happy. But even if they have had a bad start, there's still the possibility that you can make things much better for them. One of the first things to do is make sure that there isn't any overt signs of disease that would stop you vaccinating a cat or a puppy. If they look all good and they're relatively healthy, it's usually pretty safe to give them their primary vaccination. Normally with dogs, which I think we'll address first, you'd give a primary course at the 8 weeks and then another one about 2 to 4 weeks later. That then would give them their first lot of immunization. About a week after the second injection, they're usually okay to go out, and they should be quite safe. But some of the issues that you might have if you didn't would be, if you didn't vaccinate, that is, you'd have a lot of issues with infection and exposure in the environment, and that could lead to, unfortunately, the potential death of your pet. So vaccination is a good idea, and it's something that I think you would benefit from. One of the major diseases that you would want to avoid, especially in a young puppy, would be parvovirus. Parvovirus, especially between the ages of about 6 weeks and 6 months, is often fatal, and it often will, unfortunately, kill a young pet. Once they have it, it's very hard to treat. You end up treating symptomatically. You're trying to support them. They often have really, really smelly, fetid diarrhea with some blood in it, and they tend to lose a lot of protein through their bowel, basically, with the diarrhea. They can vomit as well, and it has a really distinctive, really disgusting smell, much worse than normal diarrhea, and they look quite ill. They can be quite painful. A lot of the time they'll be a little bit weak. They may not be able to stand, but when they're in that state, it can be quite difficult to save them. They're normally I guess the best hope they have is hospitalization and fluids, symptomatic treatment, gut support, antibiotics, anti-inflammatories, painkiller. But they are often very, very sick, and it can be very hard to save them. So vaccinating your pet early will save you all that trouble, and it will hopefully prevent any of the hospitalization and all the nasty things that go with it that you might have to experience. So that's one thing you should definitely try and do. The other one is distemper. Distemper is quite similar to human measles. They're often, again, not something you'd see probably as much as parvo, but it is obviously something that you want to avoid. And again, vaccination is going to be a way of avoiding that. Another one that you'd avoid is hepatitis, canine hepatitis. That's caused by an adenovirus. That again is, you do see signs that a liver disease, which might include jaundice, going yellow, so the gums might be a little bit yellow. The animals are often painful, very weak. They often have enlarged lymph nodes under their chin. They will also be a little bit anemic. They often leach blood, so they become quite weak. That would also be less than ideal trying to treat in a young animal, because when they're small and little, their metabolic demands are higher, and they're tougher to save. Their immune systems aren't as well developed, and they end up they can be very hard to save, basically. So again, you'd want to avoid that if at all possible. The lack of obvious cures means that you are slightly dependent on the animal mounting some sort of response itself in spite of all your best efforts. So you do need to be, again, avoiding this by vaccinating your pet. Another issue you might encounter in terms of infection in a young pup would be leptospirosis. Lepto is a bacteria. Again, it's quite an interesting one because a lot of these infections come from farm, wetland type of areas. They can catch it from feces and urine from other animals, rodents, so unhygienic areas, often associated with water. So basically, a lot of the walks that people go on involve the woods or farmland, things like that. So it's often one of the things that they can pick up, and that is something that will be quite hard to, again, cure. So you would, again, just avoid all that trouble if you can, just by vaccinating your puppy, and that's probably the simplest way to avoid it. The other thing you might, if you ever end up taking your pup into kennels, or if they need to be boarded, they sometimes need to get a nasal vaccine. Again, this wouldn't really be recommended unless you're leaving your pet with a carer or a dog kennels. But they have a little vaccine against kennel cough, and kennel cough is a mixture of different agents, the flu-like viruses, Pasteurella, Bordetella, different bacteria, but it's something that you do just to avoid the spread of the kennel cough. But the kennel cough is something that usually it won't ever kill a healthy dog. It's just a bit unpleasant, but it's the sort of thing that you wouldn't want in a kennel, so they recommend that you vaccinate against that before you take them to the kennels. Now, in terms of our other little fur friends, we're talking about kittens. If a kitten is something that you are going to take on, again, one of the nicest things you could do for it to set it up for the rest of its life is to get its primary vaccination course. A lot of cats come from the outdoor areas, and they can be in what we loosely term colonies. So their exposure to various agents is going to be probably quite high. Normally what you would try and do, again, is take them to get vaccinated around 8 weeks, and again about 3 weeks later. So if you have a kitten that's come from a pretty good home, you'd hope that the worms and fleas aren't such a huge problem. And even if they are, they can be addressed. But one of the main things you'll have to do is vaccinate them. Vaccination, again, is going to save you a lot of trouble down the line. One of the things that you could probably try and get done pretty early within a few days of receiving your kitten would be to get them vaccinated. Lots of the time when people bring kittens to me, sometimes they say they've been vaccinated, but they haven't. So if you're in any doubt, you should just restart the course, and the 2 injections are something that will be pretty well tolerated. When you are vaccinating, again, there's going to be a few different agents that you're trying to avoid, panleukopenia being one. Again, if you end up with a situation like that, you're going to have a very, very sick kitten. It's kind of akin to parvovirus, so it's not something that you can, again, easily treat. You're dealing with symptomatic treatment. You don't want to be doing that again with a little kitten, so you're better off vaccinating them. The other one that I would try and probably mention primarily is leukemia. Vaccinating against leukemia is going to be of paramount importance. It's really something that you'd see quite often in cat colonies, and it does make them susceptible to other disease. Again, simply vaccinating will alleviate all the worry about that, so it's something that would be a huge benefit to the kitten. The herpes virus leads to flu-like symptoms. Again, you'd often see runny eyes and nasal discharge, things like that. And again, often, especially with little kittens, if they have a really bad infection, if their nose and eyes are really quite infected, they can often have trouble smelling, and it often leads to inappetence and things like that. And if your nose is blocked, you have to mouth breathe, and it's not the most pleasant thing. So it is really worthwhile vaccinating against that. I don't think it's something that you want to experience, but anytime I have seen it, it's always been you are just treating the symptoms and hoping for the best. Similar to that would be calicivirus, which again can cause flu-like symptoms, but also severe mouth pain and ulceration, and they tend to get a lot of gingivitis. Some cats later in life end up, the gingivitis is so bad that they end up having their teeth actually removed because it's so painful and is chronically infected. So again, if you can try and vaccinate your kitten against these agents, it's probably going to save you an awful lot of trouble, and it's going to improve the welfare of your kitten, which will become your cat, quite considerably. So I would advocate vaccinating your kitten or your puppy. That's it on vaccines. And that's everything that we need to know about vaccinating your kitten or your puppy. I hope you found that of some use and help, and go get them vaccinated, and we'll see you next time for the next episode.